ICANN, we know that all of our hospitals are faced with many challenges. Each year, we like to take a moment to honor those hospitals that have found innovative solutions to improve operations. With the Impact Award, we were looking for projects that met the following criteria. Projects that have found a creative way to motivate and inspire staff. Projects that initiated a new approach to improve patient care. Projects that implemented a new process flow or life safety improvement. Projects that strengthened the health of your community, and projects that improved the well-being of staff, patients, or community. We had several applicants this year, and it was difficult to decide on one winner. So, we picked 4, and here they are. Northwestern Medicine, Valley West Hospital.
The project we submitted really was based on what we've seen as an increase in behavioral health patients visiting our emergency department. It's reported 70% of nursing staff and 50% of physicians have been assaulted. The enhancements that were part of this project included an overhead door that can be lowered. We have installed anti-ligature fixtures. We have also implemented a visual monitoring system, and then we have specially designed doors that prevent patients from barricading themselves inside the room. The implications this project has had on our rural community has been tremendous. It provides a safer environment for our patients and a safer environment for our staff, and it allows our local law enforcement to remain in the community to respond to other needs.
St. Joseph Memorial Hospital.
Our culture team came together with 4 objectives that they wanted to focus on for our staff to build resiliency and self-care. The first being a rounding process for our leaders to do self-check-ins with the staff. The second was an end-of-shift debrief, where our units debriefed at the end of the shift and allowed for staff to get off their chest anything that was bothering them and to leave on a good note. The third being a way for our staff to give input. Many felt that many of the changes going on were happening to them versus them having a voice. Our fourth objective was building a relaxation room for our staff. This is the space that you see behind me. We are most proud of this because our staff can come here, take a break, reset, and then be able to gather their thoughts and go back out and care for our community. I'm truly proud of the work that we accomplished here at St. Joseph Memorial Hospital in the height of the pandemic. I truly believe that we laid a strong foundation for our staff to build resiliency and promote self-care. I'm excited to see what next steps that our organization takes to continue to build resiliency and self-care in our staff so we can continue to provide care for our community.
Horizon Health.
The sepsis improvement process team was started in 2020 due to a low pass rate in 2019 of the sepsis core measure of 38%.
Over the course of 2020, despite everything that COVID had thrown at us, we managed to bring that up to about 56%. At which point our CEO proposed that we could get to 100%. Our quality department was able to help us by breaking down all of the nuances in the step 1 and then providing education to the core team. We broke down step 1 into a series of logical if-then steps and then wrote that up as a presentation for nursing and medical staff at the hospital. We then had our clinical informatics folks go through and tailor our order sets so that they would default to the various antibiotics, lactate, cultures that we would need for a sepsis patient. Our last sepsis fallout was in April, and we've been 100% for SEP 1 measures since May.
The success of the sepsis improvement process at Horizon Health is not due to one person, but due to the dedicated leadership and team of staff willing to learn and better care for their patients.
Illini Community Hospital.
The idea actually came from a DNV surveyor that we had, just brought it up as maybe a best practice, something to raise morale, get multiple generations involved. Nurses here today honor Jennifer and her life as a nurse by stepping into people's lives and by special moments. She was there when a calming, quiet presence was all that was needed.
She was there.
In the excitement and miracle of birth, or in the mystery and a loss,
she was there.
In the silent glance could uplift a patient, a family member, or a friend,
she was there.
Jennifer, please report to duty. Jennifer, please report to duty. Jennifer, you are now released of your earthly duties.
Congratulations to all 4 of the ICANN 2021 Impact Award winners. Brought to you by our sponsor, O'Shea Builders in Springfield, Illinois.